Considering the steps of laparoscopic port placement with a view to laparoscopic appendicectomy, you will have already seen some of the instruments used during this process. It is usually best to try and find a technique that suits you and then stick to this, as then you will have an automatic way to safely enter the abdomen laparoscopically. One of the ways of entry of a 10mm port which will be used as the camera port is via dissection at the umbilicus itself to the cicatrix. Typically the umbilical stump is grasped with a pair of forceps such as Littlewoods and pulled vertically up in order to pull the peritoneum away from the abdominal organs inside. Making a vertical incision normally below the umbilicus at this point, the cicatrix can be dissected down to, usually with some gentle wiping of a swab. Once the cicatrix has been identified, usually as a white or yellow clear structure, it should be incised with a vertical incision around 10mm in diameter. This should only be done whilst the abdominal wall is held with the Littlewoods away from the organs inside. At this point we can introduce the 10mm laparoscopic port, which is introduced with an introducer. It should go in via the incision made in the cicatrix and shouldn't be forced into the abdomen. Once the port has been placed and the introducer removed, a camera can be used to see if you are inside the abdominal cavity or not. If you are, then gas can be connected and inflation of the abdominal cavity will take place. For a laparoscopic appendicectomy, 2 further ports are needed, and these are normally 5mm ports, which are placed, as we've seen, suprapubically and into the left iliac fossa as well. This is to create triangulation, by which the end point, being the end point of the triangle between the suprapubic and left iliac fossa port sites, can be easily navigated. With the camera showing the entry of these 5mm ports, local anaesthetic is applied, which can be seen as a needle going into the peritoneum. A 5mm incision can then be made with the scalpel, and the 5mm ports introduced under direct vision from the camera. The diagram shows the view of the inside of the abdomen, showing a successful insertion of a 5mm port. Of note is the inferior epigastric vessel, which run close to the site where the ports are put in, and every effort needs to be made not to hit these, as you can imagine, they can bleed.